So indigestion or acid reflux are the same condition, and that results in a burning sensation felt behind the breastbone as a result of too much gastric acid actually getting into what we call the esophagus, or more commonly known as the food pipe or the gullet. It's a common misconception that you have a valve at the bottom of your food pipe. You don't. The only thing that stops stomach acid actually regurgitating back up into the gullet is the position and frankly, gravity. So it's very common, depending on what lifestyle habits we have or what behavioral traits we follow, for you to get acid in the wrong place. Acid is completely normal. It is part of the digestive tract, and you need it to actually break down certain food groups. But when you have either too much acid production because of dietary changes or positional changes, then that acid can get into the wrong place, i.e. the food pipe, and that's actually what causes the symptoms of heartburn. So there are lots of common triggers, and individual causes can be specific, but what we will find is that if you have a rich diet which contains a lot of fatty foods, that takes longer to actually digest and it sits in the stomach for longer. What that means is that you will produce more acid, and of course, if there is more acid in the stomach, then there is more chance of that acid getting up into the food pipe and causing your symptoms. There are also certain food groups which are more acidic in nature. So, for example, tomatoes, lemons, onions, these are common food groups which are more acidic and therefore cause the pH of your stomach to be lower than it would ordinarily be. And if that digestive juices then gets up into the food pipe, that will cause heartburn, similar to your own native acid, as I discussed earlier. In addition to that, there are simple behavioral traits that most of us now fall into. So laying down soon after eating. Gravity is required to keep acid out of the food pipe. And actually what lots of us are doing nowadays is after a meal, because we have an increased sedentary lifestyle, many patients will find themselves relaxing on the sofa or possibly laying down in bed if they've had a late meal. And of course, with there not being a physical valve at the bottom of the food pipe, any digestive acid that is in the stomach at that time that you lay down will then increase the risk of it getting into your food pipe and causing heartburn. So there are easy lifestyle modifications that you can make to try and improve the heartburn. So a lot of people will use 3 or 4 pillows to go to sleep with the hope that this reduces the amount of acid. But unfortunately, this does not work, because once you're asleep, most people will actually slip off those pillows. What we recommend instead is an under mattress wedge. This is an actual foam triangle which goes underneath your mattress and keeps the head elevated only by 10 to 15 centimeters, but that means that throughout your whole night's sleep there is less chance of acid getting into the food pipe because of the fact that you're actually sleeping in a head up position. We also recommend people sleep on their left hand side. That again is to increase the gravity effect on the liquid in the stomach, and that will reduce the risk of that getting up into the food pipe. Avoiding late meals or laying down soon after eating is another way to try and help reduce the amount of heartburn that you have. And then, of course, dietary changes where you avoid fatty foods, avoid spicy foods that contain a high acidic index will reduce the amount of heartburn that you experience. Sometimes a patient can try all of those things and unfortunately they still have symptoms, in which case we would offer them usually an antiacid medication called omeprazole or pantoprazole, and they reduce the concentration of acid in the stomach. I haven't listed all of the options available, but those are some of the commonly used antiacid tablets that you'll be aware of. So you should speak to a gastroenterologist if you are over the age of 55 and you have new acid reflux. So that's where you previously were not troubled by indigestion or heartburn, and then you develop it relatively out of the blue. And if you are over the age of 55, then those two factors would highly recommend seeking a specialist opinion. Or if at any point you have what we call alarm features, and those alarm features can be unexplained anemia, and that's detected through a blood test that your GP or another doctor might do. Unexplained weight loss, vomiting, significant nausea, or any problems actually swallowing food. If you were to ever to vomit blood, or you notice that your stool becomes black and sticky, that might suggest that there is bleeding from the gullet. Those are the significant times, or they are the causes for which you should see a gastroenterologist. So the most important treatment for heartburn, as boring as it might sound, is lifestyle modification. So actually changing your diet, changing your eating habits, and changing how you sleep. All of those will give you the best chance of reducing heartburn. Simple over the acid antacids you can be purchased. So there are lots of brands out there, but any of the antacid tablets or antacid liquids you can buy. And of course, your GP or a consultant gastroenterologist can prescribe antiacid tablets such as omeprazole or lansoprazole. Another version is pantoprazole, and you may have heard of esomeprazole. They all end in zole, and that tells you that they're doing the same job. Now, the benefit of taking those medications is that you will usually get symptomatic benefit. There are very few side effects to those medications, and they are very well tolerated by patients. And the most commonly prescribed medication in the world, in fact, is omeprazole. So we know that the medication is very safe in patients. The long-term side effect to having to rely on a tablet is partly the burden of taking medications, and we know that that can become quite high as patients become older and develop more conditions. And before you know it, sometimes you can end up on 3, 4, 5, or sometimes even 10 tablets every day. So if you can make those lifestyle changes, which means one less tablet, then that is, of course, a benefit to you. If you are the small proportion of patients that do not respond to a PPI, a proton pump inhibitor, that's the medication that we're talking about, then surgery is an option, but you have to meet very specific criteria with regards to how much acid is in the food pipe and how much damage is actually being done, which we would normally assess first with a gastroscopy, which is a camera test that goes into the gullet. And then depending on the result, we might then ask you to have what's known as manometry and a pH study, which involves a very fine plastic tube which goes via the nose into the stomach for 24 hours. And that actually records exactly how much acid is getting into the food pipe over that 24-hour window. And depending on whether or not you meet the criteria, you can then be referred on to see an upper GI surgeon who can talk about procedures called fundoplication, and that is to try and prevent acid reflux. So it's very important that you speak to either gastroenterologist or even your family doctor, a GP, if you have any alarm symptoms, because they can sometimes suggest a more serious underlying problem, one of which would be esophageal cancer that we would want to make sure doesn't go missed. The difficulty with detecting things like Barrett's esophagus is that it is a symptomless condition. So we know that Barrett's esophagus develops due to excess acid exposure, but there are lots of people that will have that exposure without having indigestion. There's lots of research at the moment going into how we can actually identify those patients that don't have symptoms and what the best way is to follow those up. But certainly if you know you have Barrett's esophagus because you've been told that following a previous gastroscopy, then depending on the length and how severe the Barrett's esophagus is, your gastroenterologist will recommend an interval gastroscopy. And that can be anywhere from 2 years up to 5 yearly. If, however, you have alarm symptoms, which we've mentioned above, so unexplained anemia, weight loss, a mass or lump that you can feel in the upper abdomen, any vomiting, especially if it contains blood, or a change in your bowel habit where it becomes black and sticky, we would recommend that you speak urgently to a doctor, either your GP or a gastroenterologist, so that they can arrange gastroscopy and assessment for you.